Hey everybody, welcome back. This is Dental Unfiltered. I'm Matt Brown here with normal co-host Dr. Andrew Vallo. And today we have an awesome subject for you guys that I'm really excited about. I'm a marketer and we do some things sometimes and dentists are like, I don't know. This is weird. And Andrew gets real creative with marketing. Andrew's kind of like the unofficial test lab at Energize sometimes. Andrew comes from crazy off the wall crap and he'll come to us and say, hey, I want to do this and stuff we normally say no to any other client. But Andrew spends such an enormous amount of money on marketing. We're like, hey man, you got the budget. You want to gamble it. You understand the consequences. Let's go. And Andrew recently did a campaign called Free Dental Implants. Now, everyone listening is going to have a gut reaction and be like, oh, you're devaluing dentistry. That's some bait and switch crap. This is bad. You guys are evil, all that crap. But what I can tell you from looking at the data is Andrew's helping more people with dental implants than you probably are. So, Andrew, free dental implants. Tell us.
Yeah, man, it's funny. I feel like when a lot of people hear a off the wall marketing idea, they think that's crazy. When I hear an off the wall marketing idea, I get excited. And I haven't tried all of these crazy ideas that I've heard. I remember listening to the Shared Practices podcast one time before I ever owned a practice, and George Hariri was talking about how he did a free car giveaway. So he bought a used, but still in nice enough shape. It wasn't like too old or anything, but a used Mustang convertible. I think it was red, catchy. And I'm trying to think if he actually like somehow put it in the office or right out front, maybe like right in the parking lot, right out front. But anyways, huge poster, did this free win a free car basically. And I think there were different ways you could enter this raffle, referring patients, doing treatment, whatever it was. There were certain ways that you could get enter in this raffle. And I remember listening to the story and getting excited and being like, this is so cool. And at the end of the whole thing, he basically was like, yeah, it didn't quite turn the ROI I was expecting. It was a little bit of a dud. But in my mind, like I truly believe like that is how you can make monumental changes in your practice, is by trying some of the if you do the same things that every other dental practice out there is doing, you're going to have the same results as every other dental practice out there. And so unfortunately, the vast majority of dental practices out there struggle with new patient numbers, struggle with marketing. It's different if maybe they're a well-established practice that's been there for a long time. But if you're a younger practice, if you're still in growth mode of your practice, you need to sometimes take some risk and try some things that might sound crazy. Guys, my Invisalign parties, which we've talked about many times here, I will tell you, the very first Invisalign party that I did not give away a free Invisalign case. So the very first party I ever did, I think I advertised like win, $3,000 off Invisalign or something like that. And I think we've talked about this before. When I first started doing Invisalign, I was timid to give too big of a discount, do it at too low of a profit margin. And at that point, I was doing all the dentistry, so I didn't even have to worry about paying associates to do it. I was, paying myself to do it. But again, I think I had a little bit more of that scarcity mindset, where over time it's really evolved, and I've realized what a practice builder Invisalign can be, and how many patients see Invisalign as a commodity and price shop Invisalign and all that stuff. But that first time, I was hesitant to do it for free. I thought about it, and I said, no, I don't think I can give away a free case. And we had modest results. It was fine. We sold a few cases that day. But we saw a huge jump with the second party when I finally bit the bullet and said, you know what? Screw it. I'm going to give away a totally free Invisalign case. And all of a sudden, we had way more people sign up, way more people show up, close way more cases, and I gave away a free case. And now I give away free Invisalign cases at all of my general practices every single year. So I'm giving away, probably this year I'll give away probably close to a dozen Invisalign cases between our different parties and raffles and events and all that stuff. But this year we are going to do hundreds and hundreds and hundreds of Invisalign cases. Actually, my goal for our offices this year is that we start 750 new Invisalign cases in 2025, and I think we can do it. So
Wow.
So again, what's a dozen free cases if you can do 750 starts? It's nothing. So getting back to this idea, I was actually talking with Matt and Ryan, his co-owner for Energize Group Marketing, and we were just kind of spitballing some ideas. And they had mentioned this idea because we do a lot of marketing for implant consultations, and we get a lot of implant people coming in for these implant and we already do them for free. Again, lower barriers, free CBCT. But I had mentioned I want to get even more of these implant consults in there. Now I've got experienced implant doctors at essentially every single practice. So even my general practices, we're doing a fair bit of implants now. So we're doing a lot more advertising for it. And I'm like, I want to get even more of these implant consultations in the door. These are cases that can really move the needle and bring these practices to the next level. And they had mentioned this idea they've been thinking about, which was giving away free dental implants. And so I'm thinking, how can I reasonably do it? And the initial suggestion that they had was to have like a raffle wheel with little ping pong balls or whatever in it, and one of them has a free case, and other things have other discounts or stuff in them. But I was thinking about it, I was like, you know what? If I do this, then every single person who walks in has a chance to win free implants. And there's no control. At some point I was like, I feel like I need some control over how many free cases I'm giving out. So I decided to kind of do it another way. And so the way we do it for the Invisalign parties is there's one winner. That's a raffle bowl. There's one winning ticket in there. And that day, everyone draws from the raffle bowl. Whenever the winner is selected, that's the winner for the event. So there, it doesn't go back in. There's not multiple winners. There's one free case we give away at each office for each Invisalign party. And so I wanted to do something similar for the dental implants, but in my mind, I was like, I can't just have a raffle bowl, because then it's like, if someone wins it early on in the contest, we're really going to keep running these ads for win free implants when there's no opportunity. And in my mind, that's not right. They've got to have the opportunity to actually win. So we decided to do the raffle another way. And so basically it's win free dental implants. The first step to qualifying is to come in for your consultation. And then in order to earn raffle tickets, they can do different dental treatments. And depending on the treatment that they're doing, they get certain number of raffle tickets. And at the end of, it's like a 3-month period that we're running this contest. So at the end of this 3-month period, we will draw one winner from this bowl of raffle tickets. And those who have done more treatment have more opportunities to win. And if they win and they've already completed their treatment, they will get a refund for the amount. If they've won and they want to do more treatment, then they can get more treatment. And it's 2 free dental implants what we're giving away. So that's and we're placing the value at $3,800.
Is that implant, abutment, and crown?
It's just the implant placement.
Just the implant. Okay.
Yep. So we've got so basically we've got a sheet that has the codes and exactly what it is and the value of the prize and all that stuff. And when people are scheduling their consultations, we tell them coming to your free consultation is the first step to enter this free dental implant giveaway. So we don't say, just show up and you're entered or anything like that. We just let them know that's the first step to qualifying. The team will have more details when you come in for your free consultation. So basically, at any of the, and we're running it at 4. So we start at 1. I like to guinea pig things. We started at 1 implant office. Immediately, we saw an uptick in people scheduling consultations. And I wanted to see how people reacted when they came in. Even though, again, we're trying to tell them up front, this is the first step to enter. People hear what they want to hear. And sometimes
they read what they want to read. You can be clear in text and they read what they want to read.
So I wanted to kind of give it, at least a few weeks of running these ads, bringing in these consultations to see what kind of response we got. And as far as I'm aware, at that first office and in those like first month we were running this giveaway, we didn't have a single person complain about the fact that they came in and, had to enter to win. Even a lot of people that didn't start treatment yet left 5-star reviews about how amazing the team is, how cool it is that we're doing this giveaway, things like that. So once I saw that and I realized, okay, this really can work, I implemented it at a second office. And then just this last week, we got it up and running at 2 more practices. And actually the newest 2 practices we're doing it at, they're general offices. So we don't only do implants there. Now we're advertising win-free implants, but actually when they come in, and we're telling all, so it's not just the free consultations that, we're telling about this. All patients that do treatment get raffle tickets. They get entered in. It's basically a patient appreciation raffle. Hey, for coming to our office, trusting us, doing some of your, at least starting your dental treatment with us, you're going to get entered in this raffle to win. And at that office, it's $3,800 in dentistry. So again, if they've got that dentistry that they want to do, then they can, and they win, they can do the rest of the dentistry. If they've already completed the dentistry, then they can get a credit on their account or get a refund or, whatever it is. So the cool thing about the general office is you can get entered just for doing a single filling. So like you do a filling, you get a raffle ticket for that. And again, bigger treatments come with more raffle tickets. So the patients that are doing more treatment have a better chance of winning that prize at the end. So first time we're doing it, kind of a off the wall, crazy idea, free dental. Actually, when I told one of our office, we're having our quarterly meetings with all of our office managers right now. I meet with them every quarter with the rest of our leadership team. And I told one of our newer office managers that we're doing this, and she's kind of like, wow, that's a pretty big give, $3,800. And I said, yeah, but I look at it this way. It's over a 3-month stretch. And I look at it as extra marketing spent. So, we're basically investing an extra $1,200 or $1,300 a month in marketing. And the goal of it is, one, to make the rest of our marketing dollars more effective by having this free dental giveaway that we're doing. And two, patients that are already at the practice or in the practice that are, getting their treatment plan, they know they need the treatment anyways. Think about it. A lot of times patients are like, yeah, I'm going to do it, but things are busy right now. Maybe I'll do it in 6 months. Now it's like, you know what? Why don't I just do that filling right now or that crown right now? I know it needs done anyways. And now I've got a chance to enter this giveaway where I can win $3,800 in free dental treatment. So I think it gives one more bit of
I think it
encouragement.
spurs an opportunity behavior of
Yep.
like this. It's like dentists want to be like, oh, it devalues my most valuable dentistry. But
Yep.
what it
Yep.
does is it spurs an opportunity behavior from. Let's profile the patient real quick, okay? Patient probably has been a dentist in 10 years. They're probably definitely periodontal. That they need a couple implants. There's definitely some more work there for sure, other than the 2 implants. There's always more work than the 2 implants, right? This person has made it a lifetime habit of avoiding the dentist. Now you create an opportunity behavior of like you could get free implants, 2 of them. You could. Now everybody that has 2 implants they know they need in their mouth or they perceive that they need is going to reply to that ad for the chance to win the 2 implants. Now, you're right. A lot of them won't do the treatment. A lot of them won't even show up for the freaking appointment.
Oh
But
yeah.
the ones
Yeah.
that do, the ones that do are high value mouths in your chair. And if you have good chairside manner and it's a great patient experience, even if they don't win, they are now in the chair at the practice. They are going to seize the opportunity and say, I've been avoiding this forever. I'm finally here. Let's just do this because I know I'm not coming back here because I'm terrified of you. Right? The opportunity behavior is the point.
I think it kind of self weeds out a lot of the people that maybe aren't a good fit for the promotion, anyways. Because I'll tell you what, when we tell when people are like, how do I enter? Oh, first step is to schedule your free dental consultation. Oh, never mind. I don't want to come in for a free hour consultation. I'm not wasting my time.
Yeah.
Okay, no problem. Hey, like you don't have to do it, but I think it does self. So like the people who actually schedule and actually show up typically are actually interested in doing some dentistry. And it's just a question of, are we the right office for them? Do we make them feel comfortable? Can we find a financial solution that's going to work for them? And again, we don't charge anything for the consultation. So it's not like we're baiting people to come in for a chance to win free implants, then we're making money off them, charging them for the consultation. It's a totally free, no obligation, 60-minute consultation. We take free x-rays for them. We'll take free CBCT for them. So, I mean, honestly, it's a great value, but it creates some buzz. It creates some excitement. I mean, think about just even like, what's it, Mattress Mac down in Houston. You always see these promotions
The
he
guy
does
is
on the
famous.
news. Oh, he's crazy, but like,
A buddy of mine won one of his things.
really,
Yeah,
that's cool.
a buddy of mine, a couple years ago won like the full house of furniture from him.
That's awesome, man. I think he's like Houston Tex or Houston Astros fan. So I think whenever they're like in the World Series or whatever, he often will do these promotions. But it's like basically the promotion is if you come in and buy your furniture between X date and X date, and if the Astros win the World Series, then your furniture's free. And here's a genius of these giveaways. He takes out an insurance, or no, he bets on the Astros to win the World Series a certain amount. And so if he wins, then he's winning all that money that he's basically having to pay back to the customers. And if he loses, he doesn't, but he gets all this extra business. So it's like it's his way of kind of, I think, hedging his bets. Other people take like insurance policies, I think, on these giveaways. For us, I mean, it's much smaller potatoes. I mean, it's $3,800 per office for a 3-month promotion. And again, some people might think that sounds like a lot of money. For me, an extra $1,300 a month in marketing, like I'll spend it, just like that. I mean, I was in my marketing meeting with my team at Energize, and now I've got kind of like a full team there that comes to these meetings I have every couple of weeks. But we were talking about the new offices and patient flow, and honestly, things have been good. But I was like, man, with now that we're at 7 offices, and now that I've got to kind of worry about keeping each of these offices full of new patients, like I just feel like it's spreading things a little bit thinner. I mean, we've got Instagram stuff that I do on my own too, but it's spreading that a little bit thinner. I was like, I think we need to increase things. Like let's add another $1,000 a month to each of the Google advertising campaigns, and just like that. So, guys, I'm not afraid to invest in my offices. I'm not afraid to invest in marketing. Anyways, so this is kind of the contest we're trying out. So far, we've seen an increase in consultations. So far, we've had nobody that I'm aware of that was really upset about the fact that you had to do dentistry to enter. Again, it's a free, no risk consultation. Takes 60 minutes to come in. It gives my team extra at bats. It gives them the opportunity to see more consultations, to see more patients, to meet more people, to show more people the experience that we can provide. And again, if you've got a great team and you've got yourself, you've got great bedside manner, if you've got associates with great bedside manner, more at bats is a good thing. And every single person's not going to do it. And honestly, I've had these conversations with some of my associates in the past who I think sometimes get a little bit frustrated with the free consultations. And sometimes, everything in life is ebb and flow. So, you'll have weeks where you've got a good show rate, on these consultations, and a number of them move forward with treatment. And at, those weeks, it seems like you're a freaking genius. You're like, oh my God, like, I can't believe everyone's not doing this. I should spend even more on marketing. Like look at all the cases we're getting. And then you might have the very next week with a terrible show rate. It seems like all the consultations just are not showing up or canceling the last minute. The ones who do show up have no interest in actually moving forward with dentistry. They have no way to pay for it. They were just hoping to, get something free or whatever it was. And those weeks, you might feel like, man, like, why am I doing this? This is stupid. It's not getting me anywhere. But you just have to, and I talk to my associate docs a lot about zooming out. I think as a dentist in general, we often get lost in the weeds. We're in the trenches. We're seeing all these patients. We're doing all this dentistry. We can only see, with kind of like this microscopic view of like what is going on in our office world today at this time. And it's tough to view out. And I had this conversation with an associate lately or recently who's been producing like $160,000 a month on average the last 3 months or so. He's really ramped up his production, and that's only a 4-day week. None of my associates work more than a 4-day week. Some are only doing 3.5. I said, are you happy making 160,000 on a 4-day week? Oh yeah, like this is, if I can keep this up, or maybe we can even like increase a little bit, but like this is amazing. This is way better than I thought I could do right now. All that stuff. I said, okay, so like whenever you feel like you're getting lost in the weeds, whenever you're frustrated with a free consultation that's being difficult, or whatever else it is, just like kind of stop for a second and zoom out and like think about like, how's this month going? How's this year going? And realize, sometimes we've got to kind of pay our dues, or sometimes we've got to do things that certain days feel like they suck. but in the long term, they're going to move us ahead. They're going to make us more successful. So I think that's an important lesson, for my associates, but also just for all dentists in general is like, there's no perfect. I say that to my team all the time. I'm like full of cliches, chief repeating officer, but there's no perfect systems. And there's not. There's no perfect marketing. There's no perfect giveaway. There's no perfect scheduling system. No matter what our free teeth whitening, again, tons of new patients. A lot of them come because of the free, maybe they're not coming specifically for the free teeth whitening or only for the teeth whitening, but that was kind of what grabbed their attention. That's what got them interested in the beginning. It's not perfect. We've got people that come in that are mad because they assumed it was free in-office teeth whitening, even though nowhere in the advertisement does it say anything about in-office. It's professional grade whitening kit. My team knows how to explain it to them. If anyone asks, we tell them. We don't try to, dance around the fact, oh no, it's a professional grade whitening kit that you get to take home with you and use at home. So like we tell them if they ask, but people think what they want to think, assume what they want to assume. Every once in a while, you get someone who's in the office. They're all mad because they thought they were getting a $600 in-office whitening for free as a new patient. And my team gets a little frazzled, and maybe the office manager reaches out to me, or someone on the team does, or whatever it is. And we have these conversations, guys. There's no perfect system, but the thing is, like the 9 people that came in that day for the new patient special, the free teeth whitening, and were super happy with the office and loved it and loved the fact that we give a new patient gift. Those aren't the ones that stick in our mind. It's like that one person who comes in and is a jerk. So again, we've got to kind of zoom out and think about big picture. How are we doing? Guys, we're seeing 240 new patients a month. Our office is growing every single month. We're scheduling lots of treatment. We're getting lots of 5-star reviews. We're getting lots of referrals. So why would we let that one jerk ruin our day? I mean, it is what it is. So again, I think we've talked about this before. You've got to break a few eggs, to make an omelet. You can't be walking on eggshells in your practice. You can't be afraid to push now do it ethically. Like, don't do anything that's unethical, illegal. I'm not saying to do anything stupid, but you can't be afraid to push the boundaries sometimes. It can be hard to get people excited about going to the dentist. So like, that's kind of my goal is how can I make people more excited about going to the dentist? Free new patient gifts, free giveaways, have a chance to win Invisalign, win a new car. I'll probably never do that, especially listening to, George's analysis on how it worked out for him. But I thought that was a really cool idea.
Didn't we talk about that a couple years ago? Didn't
We
we had a conversation about that once where you wanted to try that.
I don't know if I ever got like serious. Maybe we mentioned it in passing.
Yeah.
I don't know if I ever got like super serious about it. But my point is, I've had a lot of people listening to him talk about that where like, oh my God, that's crazy. That's stupid. I would never do that. And I'm like the opposite. I'm intrigued. I'm like, ooh, that's really like how the wheels are turning. How can I make this work for me? Or maybe it's not a car. Maybe it's something else. But like, and I did at one point, I did much smaller scale, but I did win a free $500 Visa gift card. People get excited about big prizes. I see a lot of dentists that are doing, patient appreciation raffles.
I'll tell you this, no one gets excited about a $99 new patient special.
Well, yeah.
I mean, not like they do for the free giveaways and free Invisalign and stuff. Like the traffic difference. They think, oh, we're going to do a $99 new patient special. Bro, the traffic difference is immense.
I think that's a whole separate thing. I feel like the low barrier new patient special does help get people to schedule who don't have insurance. So I'm a proponent of that. But like running that, you're right. Like those ads do not perform nearly as well.
It's like your marketing is like a golf bag. You have a putter, you have a driver, you have a wedge.
No, that's a good point.
The problem in dentistry right now in marketing is it's like these people are on stage, and I'm on stage with a lot of these individuals, and they're like, you should have a $99 new patient special. And then dentist goes, oh, that's all I need in my golf bag is the $99 new patient special. No, you have a whole lot of stuff in your golf bag. Your golf balls in your golf bag, your balls are your budget. Okay? If you have a $1,500, $2,000 budget, you got one ball. That's it. You have a $20,000 budget, you got a whole lot of balls you can keep hitting. And then you can figure out which club hits best to get you close to the cup, right?
Yeah.
And you can figure that out. So it's like, there's times you need a driver and your driver to drive immense traffic is free Invisalign, free implants. And there's times you need a putter, but you might need more budget for that putter, right? To get more chances to get in the hole, right? It's just, I think a lot of times in our space, it's very singular. It's very like, I do the new patient special, I do my free thing. No, no, no.
Yeah.
You need lots of different tools for lots of different kinds of patients for different scenarios.
Well, I think here's the thing, Matt. I believe that the vast majority of dentists spend too little money and too little time on marketing. So I think you're absolutely right. I think a lot of dentists have one club in their bag, and it's probably an old club they got at a garage sale, and
Yep.
they're never out actually at the driving range or playing. It's just sitting there. So, but they expect it's going to work. Hey, well, I've got Google Ads running. Okay, but you're doing $1,000 a month in Google Ads, and that's it. And you're not even paying any attention to the ads or the results or anything like that. Guys, here's the thing. I've talked about before. I use Matt's company Energize. I've used them for years. They're great. No complaints, but I am still super involved. And as time goes on, I'm only getting more involved as our group grows, because guess what? There's more new ads that need to go out. There's more analysis that needs to be done. There's more knobs that need to be turned. At this point in time, as CEO of a group of, soon to be 8 practices, who I'm not practicing dentistry anymore. So I've got all week to do admin stuff. I am probably spending like 35, probably 1/3 of my time is spent on marketing analysis, new ads, new patient leads, systems for follow-up. Basically, I would say 1/3 of my time is literally spent on our systems and advertising and everything that is getting patients scheduled, getting patients rescheduled, getting patients in the door. I told my team the other day, guys, I have a lot of different responsibilities as CEO, but my main priority is making sure that every single one of your offices has a strong influx of new patients every single month that are showing up for appointments. So to me, that is super important. I haven't lost sight of it. Our group is growing and growing and growing, and it hasn't become any less important to me. It's only become more important. And I think that's the other problem too. A lot of docs look at marketing as like, I just need to do this marketing and then I'm done and set and forget and whatever. It doesn't work that way. You might have something that's working successfully, but again, you can have account managers on it, but you need somebody, and maybe it's not you. Maybe you don't have the knack for it. Maybe you don't enjoy it, but then you've got to get somebody else who's on the inside of your practice and make them your marketing director and have them meet with the marketing agency that you're using and have them doing analysis on the ads and brainstorming ideas for new ads and all that good stuff too.
Real quick to add to this, you said something earlier, and I pre-apologize for the barking dog, guys. I didn't see it registering on the microphone, so I didn't think it was. So I was at the Dental Podfest like 2 weeks ago now, and I was on the marketing panel, and they asked a question of all of us marketers on the stage, and it was like Gary from SMC, it was Len Tao, I mean all the big personalities in our space in dental, and they asked, what's the barrier? What's the number one barrier for growth? And everyone had their answer, and my answer was undercapitalization of ads. You guys listen, inflation has gone up, okay, and if you don't think that correlates to marketing, you're crazy. There's more pressure on the patient now financially than ever. These people they're going to Walmart and trying to hunt down great value brand items to save money. It's costing more to get a click right now than probably any time in history. I think it's gone up by 4x in the last 3 years, right? And undercapitalization of ads. So if you're with a marketer, right, and Andrew's very proactively involved with his team that we assigned to him, and we want you guys to be proactively involved. We want that involvement. We flourish when we have a proactive relationship. But part of it is trust in the recommendation of capitalization of your ads. You have to be spending a significant amount. If you aren't, you're donating to the casino that is Facebook or Google AdWords. You just understand you're making a donation. There's a point where you spend too much and there's diminishing returns. There is a point for that. And there's a point where you're not spending enough and you're just giving away money, right? And I think the number one barrier for practice growth today, I think it's tied. I think number one is mentality of the staff, but I think real close to it is undercapitalization of ads.
Well, and talk about wasting money. I think you also are wasting money if your ad doesn't have an action item in it, if it's not catchy, if it's not creating excitement, man. I think that's the other. I honestly, I'm on social media a lot, and 95% of the time it's business related because so much of our advertising and new patients comes from social media. But I see on like Facebook a lot of other ads from other dentists in the area. And honestly, I look at these ads and like kind of laugh sometimes. I honestly I feel kind of bad because I'm thinking like there's no way they're getting good ROI. Nobody's clicking on this ad. And I think there's so much emphasis, and I know we're getting off the topic of the free implant giveaway a little bit, but I still think this is important. There is a lot of emphasis on, oh, but I want to attract the ideal patient. I want someone that wants to come to me because of my value, not because. But guys, here's the thing you've got to realize, especially in a busy city like Tampa, there's so many freaking dentists, and there's so many of these generic ads out there. Oh, here's a picture of me smiling, with my family or whatever it is. Those branding ads only get you so far, and you're going to get lost in the noise of everything else. Like the reason my ads are so successful is because they breed excitement. They breed, free new patient gifts like teeth whitening. They breed, free giveaways or, amazing pricing, half off Invisalign, things like that. That's why my ads get so many clicks and so many messages and so many leads and so many new patients scheduled, is because they are separating themselves from the rest of the ads that are out there that are all so similar and cookie cutter. And the other funny thing is I get a lot of quote unquote social media managers or experts or whatever it is on Instagram that reach out to me. They see my ads, they see that I've got 13,000 followers or whatever, and they're like, oh man, your account's amazing. I'm this social media expert, and I don't know if you're looking for a manager. I'd love to take over your account. And I'm polite, but I'm just, hey, I appreciate I'm not interested. But like the thing is, like, just because I'm intrigued, not because I'm actually looking for someone else to do that. I myself and my executive assistant kind of manage the social media and the post and the messages and all that stuff. But I'm intrigued. I just want to see what their stuff looks like, and I look at their posts on their own Instagram. I look at their follower count. Typically, they have less followers than I do, and typically their posts are those super generic cookie cutter looking type posts. And I'm thinking like, this is exactly what I want to avoid. So there's a million people out there doing social media, and a lot of them are doing it that same approach. You've got to differentiate yourself. You got to be different. I actually have gotten to know the editor of our local community magazine, which I advertise. One of the only print advertising I do on a regular basis, and part of it was just because I've been doing it for a while, and I live in the community, and I think the HOA stopped writing me violations since I started advertising there. So yeah, there's a few different reasons why I do that. But at one point early on in our professional relationship, she had sent me an email and she said, hey, I just wanted to offer, we've got like our advertising, specialist, whatever, our ad copy person here, like, would you like her to make one of your ads so it looks like a little bit more, professional or whatever the answer was? And I said, hey, and she said, no offense, I want to make sure you're getting the most out of your advertising. And I'm like, hey, I appreciate it. I promise, no offense taken. But I'll tell you what, there's a reason my ads look different. There's a reason why I do my ads the way I do. And the reason is because they actually work. So, again, I think there's so much that people want to look like, everyone else's. They want to be the super polished, super professional, branding. They don't want to devalue themselves with discounts or free gifts or anything like that. But there's a million of those ads out there. And I'm telling you, they just get lost in the shuffle. What I do in this local magazine, I put up before and after pictures of crazy Invisalign cases I've done with a big coupon in the center that says 50% off Invisalign this month. And I actually get people responding to those ads. So again, you can't be afraid to put yourself out there. You can't be afraid to push the boundaries from the norm. You can't be afraid to try crazy things that might seem like gimmicks, like free dental implant giveaways. Because I'll tell you what, if you are willing to take on those risks, they actually work and you're going to see results. So
It's going back to intentionalness and like really investing in the process and trying things and seeing what happens, right? Hey guys, this was a great episode. Please hit like, subscribe, share. Me and Andrew don't sell sponsorships. We do this purely for the benefit of the community. Please support us and leave reviews. Thank you so much and have a great day.